Good morning, everyone, and thank you so much for joining us. We're just going to give about a minute so that folks who are still coming in can join us. So just sit tight and we'll begin shortly. If you're just joining us, good morning. We're just going to wait a few more seconds while folks join us. Thank you so much for being here today. We are going to go ahead and get started. Good morning. So nice seeing so many folks in the room. My name is Inaudi Esposito. I'm the Executive Director for the Orange County Human Rights Commission, and welcome to our conversation on aging in 2020, health and social issues impacting older adults in our community. The mission of the Orange County Human Rights Commission is to work towards bringing people together and provide education and awareness around issues affecting vulnerable communities. Especially during these times where the aging population in our state and our community is facing significant and even life-threatening challenges, the Orange County Human Rights Commission continues to be committed to provide information, resources, and tools to support all members in our community. Before I introduce our panelists, I just want to remind everyone of some housekeeping things. The first thing is we're asking everyone to please keep your screens off, so your cameras off and your microphones off, unless you will be using the ASL interpreters for communication. At that point, you can keep your camera on. We are going to be interpreting thanks to our ASL interpreters throughout the entire time, so it's easier if everyone's screen is off for that. And at the end of the presentations and the conversation, we will be having some time for Q&A. So please, throughout the entire time, if you have questions for one of our panelists, just go ahead and enter them in the chat box at the bottom of your screens, and we will get to hopefully most questions, if not all questions, at the end. So I'd like to go ahead and introduce our incredible panelists, 3 experts from our community who are truly passionate advocates and fearless advocates for the aging population in our community. So first we will be hearing from Robin White, and Robin is a real estate agent. Hi, Robin, with Keller Williams out of the Middletown office, and also a human rights commissioner. Thank you for your service with us, Robin.
You're welcome. Good morning.
We will also be hearing from Anne-Marie Maglione. Anne-Marie is the Director for Office for the Aging here for Orange County. Good morning, Anne-Marie. We will also be hearing finally from Doug Hovey. And Doug Hovey is the President and CEO of Independent Living and also a Human Rights Commissioner here in the county. Good morning, Doug.
Good morning. Thank you.
Absolutely. So to kick it off, we will start with a presentation by Anne-Marie. So Anne-Marie, I'm going to go ahead and share your PowerPoint.
Okay, great. And thank you for including me in this very important panel discussion. Health and social issues impacting older adults in our community is always an important topic, but really during COVID and this pandemic, it really rises even higher than it normally is. So I want to thank Inaudi for hosting this. I want to thank the entire Human Rights Board and County Exec Steve Newhouse. So thank you. I was charged with really focusing on 3 areas. So elder abuse there are various forms of elder abuse: physical, emotional,
Can you see the screen, Anne-Marie?
I can see the screen.
Okay.
psychological, financial, sexual abandonment, and self-neglect. And, you know, it's 1 in 10 older adults will experience some sort of abuse. But for everyone that reports, 24 go unreported. So it really is an epidemic. And I always say we're dealing with an epidemic during a pandemic. Okay, so why is this? Why isn't it being reported? Why is it that 1 of every 24 goes unreported? Frankly, a lot of times it's from a family member is doing the abuse of some sort. And it starts with their adult children, then the grandchildren, nieces, nephews, other people. And truly, the victim does not want the family members to get in trouble. They don't want it to continue, but they don't want to get the family members in trouble. So they quietly suffer. Add COVID onto that. We know that abuse starts when you isolate someone. So now you have COVID, and what are we doing? We're asking everyone to isolate and stay in their homes in quarantine. That creates a lonely a lonely issue that really exacerbates the issue. So now we have people that are lonely and depressed and anxious. So what we do in Orange County is we realize that we've got to do a team approach. So we have a great team. It starts with the county executive, the sheriff, the DA, Adult Protective Services, Office for the Aging, Consumer Affairs, and we come at this together. Education, awareness, bringing it out in the open. It's a dirty little secret. We uncover it and we say we're going to talk about it. And for a lot of people, that's really, really difficult to talk about. It's embarrassing. Nobody wants to think about that grandma's being sexually abused or that somebody is stealing all of grandpa's money. They don't want to talk about it, but it's something, if we don't talk about it, we're not going to take care of it. There is help. One thing that we at Office for the Aging realized that everybody has to do things differently during this pandemic. You know, we're not doing business like we normally did. And we realized that to reach people, we had to do it differently. We used to have an elder abuse awareness symposium every year. And you know, people can't gather. So what we did was we started a partnership with community members, and we started an elder abuse awareness virtual coalition. And that's really designed to bring awareness to elder abuse and remedies to those that are affected. So we do one every week. We do it on a variety of topics. County Exec Steve Newhouse was our guest this week. We're going to be talking about veterans and abuse and elder abuse next week. And for more information, I have my information on the slide right there. You can always, everything I talk about, you can always call our New York Connects number at 845-615-3710, and we can certainly fill you in. But what I can't stress enough is you are not alone. We are here to walk with you. We are here to find a solution for you.
Could you just repeat that phone number, please?
Sure. It's 845-615-3710. And I also have it at the end of my slide presentation. So next slide. So what goes along with elder abuse is scams, and October is protecting older Americans from fraud. And the grim fact is that adults are being targeted, older adults are being targeted at a rate higher than any other population. And quite simply because they have a significant amount of money that are in their accounts. And these scammers know that. This is a full-time job for them. They are savvy. I often say if these scammers did use their talent for good, what a wonderful world we'd be in, because they are good. But some of the top financial scams are Medicare and health insurance, counterfeit prescription drugs, funeral and cemetery scams. I mean, really, really tough things that they're just the scum is reaching out to people. Anti-aging products, telemarketing, internet fraud, investment schemes, home reverse mortgage, sweepstakes, grandparent schemes. They'll do nothing. Nothing is off the table to get people to give them information. What I always say is do not give them anything. If anyone is calling to ask you for personal information, hang up the phone. Just hang up the phone. Social Security does not call you. anybody that needs something that is legitimate, they will send you a letter. So if someone is calling to say somebody has compromised your Social Security and we just need to make sure that that we have the right information, so give us your Social Security number, hang up the phone. I've gotten many calls, and when I first hear it, for a split second, I think it is the IRS. I think the IRS is calling me, telling me that I need to pay them money. But when they say, what's your Social Security? I say to them, you tell me what you have and I'll tell you if it's right. Don't do that. Hang up the phone. Hang up the phone, because the longer you talk to someone, the more they'll be able to glean something out of you, whether it's intentional or non-intentional. Also, add your name to the do not call registry. That helps a lot, because then these scammers will not be able to call you. Next slide. So there is hope, and just know you're not alone. If you're a victim of elder abuse, neglect, or exploitation, assistance is available. You can call Adult Protective Services, 845-291-2800. You can call our New York Connects, that Office for the Aging, which is our single point of entry. It's 845-615-3710. Or if you have a dire emergency immediately, call 911. You know, mental health is a real issue right now. It has been on the rise, and then the pandemic came and it really escalated. 1 in 5 older adults living in the community and 2 in 5 living in assisted care homes experience depression or poor mental health. This was before the pandemic. So you need to know this is absolutely increased, because common mental illnesses that are prevalent in older adults include depression, dementia, Alzheimer's disease, anxiety, bipolar disorder, and schizophrenia. Depression is on the rise. And if you think about it, people are COVID tired. They're fatigued. They've been doing everything that they're supposed to do, and that's great. They've been staying in their homes. They've been socially isolating, but they're not seeing their grandchildren. They're not seeing their friends. They're not seeing their relatives. They're not going to senior centers. We are social people. So when we don't have that, we get lonely, we get anxious, we get depressed. And it seems like we're going into a second wave. We're also going into flu season. We're also going into the holidays where you may not be able to see your loved ones. We're also going into cold, dark winter. So that's a real problem. There are a few issues that impact the mental well-being of older adults, and that's discrimination, participation in meaningful activities, relationships, physical health, and poverty. And even though there are laws that help with that, like the Equality Act of 2010, which addresses age discrimination, you may feel powerless to change the societal biases that we have. You know, I always say ageism is the last kind of acceptable ism that society thinks is out there, but it's not. And there are things that you can do to protect your own mental well-being. Next slide. So things that you can physically do to help yourself is, you know, be prepared for changes. That's the one thing that we can all count on, is change. And getting older in retirement involve a change in lifestyle for most people. And I like to call it like it's your next chapter. So if you're ready to retire, don't retire until you have a plan. If you have your phone ringing off the hook and you're answering, you know, 50 to 75 to 100 emails a day, and you've got these meetings and you're interacting, and all of a sudden there's nothing, it's really, really unhealthy. So make sure you have a plan on what you want to do. Stay busy and develop a routine. Get up in the morning for a reason. Get dressed. Keep relationships. Form new relationships. What you need to do is you need to have a purpose in your life. And social interactions are very, very important. And if you have issues or if you have concerns, don't suffer in silence. It's okay to talk about it. I think older adults still have this bias and this stigma about mental health. And I always say it's the same thing. If your leg was hurting, you would go to a doctor. Well, if you're having some issues, go to a doctor. Ask for help. one of the things that I always talk about, and a lot of our programs really need volunteers, and we would not be able to do everything we do without volunteers. And I tell people, when you volunteer, it's a two-way street. You are helping the person that you're taking care of and volunteering for, but you're also helping yourself, because studies have shown when you volunteer, you are happier, your blood pressure is lower, you have a better quality of life, you have a better outlook on life. Volunteering is very, very important. Giving back is very important. Keep in touch with your friends, and at that time, make new ones. Be active, but make sure you get enough sleep. Make sure you're eating and you're drinking sensibly, and do things that make you happy and bring joy. So if you are somebody that always liked riding your bike, start doing that again. If you liked hiking, start doing that again. Do things that make you happy. These are things that are keeping you connected. And as you see, the things that I've talked about is all about being social, and we are social people. So regardless of how much and how little social interaction you do it, because we need to belong and know that someone cares about us. So mental health and substance abuse also go hand in hand. And in older adults, substance abuse is on the rise. And while illicit drug use typically declines in young adulthood, it rises once you get to be 65 years old. And we're not really sure why, but that's what happens. And the 50 to 64 age group and the younger age group are more likely to get help. 65 and older do not, it's very difficult for them to get help. And it's, some of it is a lack of readiness to stop. And they think that they can handle it. There's an embarrassment. There's a cost to it. If they have to go into treatment, they may not be able to afford it. So there's different reasons why people are doing that. Next slide. So some of the reasons are chronic conditions. You're prescribed more medication, and sometimes doctors don't talk to each other. So a lot of drugs are interacting, and some are opioids, and you can really get addicted to that. Aging could possibly lead to social and physical changes. So a drug can also be alcohol, and where you might have been able to, have the 2 or 3 martini lunch, your brain, as you age, is not able to metabolize it, so it becomes more of a problem. A lot of baby boomers did some drugs in their younger days, and again, their brain is no longer able to metabolize that. Persistent pain. As you get older, you develop some health issues. 80% of cancer patients report pain, 70% with heart disease patients, and 40% of outpatients that are 65 and older. Opioid drugs are a huge, huge issue because that gives you pain relief. So from 95 to 2010, prescribed opioids went up by 9%, by over 9. Now we know that a factor of 9. We know that that was 10 years ago. That's the latest data that we have, but we know that that's even gone up even more. Regular marijuana use has been linked to chronic respiratory conditions, depression, impaired memory, cardiovascular, and altered judgment and motor skills. If you've been smoking pot your whole life, it's very hard to stop, but you have to. And again, of course, alcohol is the most common drug with older adults. About 65% of people that are 65 and older are high risk drinking, and that's defined as exceeding your daily guidelines at least once a week in the past year. Next. So there is stigma, like I said, with mental health and substance abuse issues, and older adults may truly feel alone in the situation and not reach out for help, but there is hope. And the hope for this vulnerable population. And the first step is always identifying the problem. And once you identify the problem, support is available. Orange County Crisis Center is 311 under the direction of Darcy Miller and Social Services. It is a live call center. You can talk to somebody. It is anonymous. reach out. They will be there to guide you and help you. It's 24/7. Also, WOGI is Welcome Orange Geriatric Initiative. Orange County Office for the Aging is part of this. It's helped so many people. You can call them at 845-291-4000. Or again, you can always call New York Connects and we will guide you to what you need at 845-615-3710. And, you know, I'm going to end with food and insecurity. The state of being, food insecurity is described as a state of being without reliable access to affordable, nutritious food. And I will tell you more than ever, if anything came out of this pandemic is the dire need for food and the high level of food insecurity that not just in Orange County, but throughout the state, throughout the country, that older adults are experiencing. And according to Feed America in 2018, 5.3 million seniors, or 7.6% of the entire population, are hungry and food insecure. In New York State, that's almost 10% of all New Yorkers have food security issues. Again, this is before the pandemic. I will tell you, starting in March, we exploded with calls for food. People just realized that they needed help, and we in March, April, May, June doubled the amount of food that we served to people. And it's kind of leveled off because some people did it because they were afraid to go out. So we did a triage. Do you need food? Can you afford food? Do you need us to shop for you? Do you need to pick up prescription drugs for you? That's leveled off. There are some people now that are, safely going out and buying their own food and picking up their drugs, but we've gained 40% of the people that we will have forever because they are food insecure. And we're glad that we have services that we can help them with that, because food insecurity impacts your quality of life and it creates difficulties in your daily activities and also living independently. Having nutritious meals keeps you living independently. Research shows that older adults have multiple chronic conditions and are at higher. Those that have multiple chronic conditions are at higher risk for food insecurity. And older adults struggling with food insecurity consume fewer calories and nutrients and have lower overall dietary quality. So again, that's a problem too. Food insecure seniors are likely to experience chronic health conditions such as diabetes, mental and emotional problems, reduced muscle mass, depression, lower cognitive function, hypertension, cognitive heart failure, higher risk for heart attack, osteoporosis, gum disease, asthma. 63% of food insecure seniors must make a choice between buying food and paying for medical care and prescriptions. And in addition, food insecurity significantly increases for those risk for falls, which we know are the leading cause of fatal injuries and non-fatal injuries for older adults. And that also, falls will then prevent you from being independent. So that's excuse the pun, but that's a slippery slope. Since 2001, the population of seniors has increased by 129%. That's only going to continue. The number of food insecure seniors has increased by 38%. Again, that's only going to continue. And if we do the category of what it is, and again, this is from 2018 to 2001, so we know that the figures are even higher. Food insecure, if you're white, 6.2%. If you're Black, 15.1%. Hispanic, 14.8%. Divorced or separated, 14.3%. Married, 4.3%. Homeowner, 4.9%. Renter, 18.1%. If you are disabled, 13.8%. And if you live alone, 21%. Again, a lot of that, living alone, divorced, goes to social interaction. And the reason for food insecurity a lot of times is people, truly, they just can't afford food. They have limited finances and resources. cost of healthy, nutritious food, again, all goes to finances, but accessibility to food. You may be living in a community where you don't have access to food. And that's a huge issue, especially if you're an older adult and you don't drive and you're relying on transportation. Competing priorities, like we said, am I going to pay my bills or am I going to get food? Am I going to feed myself or am I going to feed my pet? Nobody should have to make decisions like that. Functional limitations. You may not be able to physically cook. Maybe you've got some disabilities and, working the stove or picking up, picking something out of the refrigerator or a bag of potatoes is really difficult for you. And stress, because think about it. If you don't have money and you don't know where your next meal is going to come from and how are you going to pay, and am I going to be able to keep my lights on? That creates a lot of stress. We know that stress is extremely, extremely unhealthy for your physical and mental health. So 1 in 5 older adults experience at least one of the following: food insecurity, skipped meals, difficulty paying bills, medication cutbacks, and dissatisfactions with their finances. That's at least 1 in 5 experience that. More experience multiple ones. So food insecurity is a strong predictor of the greater healthcare utilization and increased healthcare costs. It just makes sense. If you're food insecure, you're just not going to be physically healthy. You're not physically healthy, you've got to have to go to the doctor. And they're saying that indirect and direct health-related costs of hunger and food insecurity in the US estimated to be a staggering $160 billion. And on average, food insecurity added about 11% of the healthcare costs of older adults and without a chronic condition. So you can be somebody that, maybe doesn't have diabetes or high blood pressure. If you don't have healthy food and nutritious food, it's going to have a problem for you. But there are solutions. There are some federally funded programs such as SNAP, which is the Supplemental Nutrition Assistance Program, Congregate Nutrition Program, that also helps with socialization. Again, during COVID, those are all closed right now. Home Delivered Nutrition Program and Nutrition Education. We provide about 1,600 meals, home delivered meals a day to people. And we have our nutritionist and our dietitian that does Zoom calls. And we also send out nutrition flyers to our home delivered meal programs just to help folks be able to try to stay a little bit healthy. We're prior to the pandemic, we were doing some cooking classes too, just to show people how you can cook a nutritious meal affordably. So all of those things are things that we could help you with. So get in touch with Office for the Aging. We oftentimes are the best kept secret in town, but there are so many things that we can do to help you. We are here to help you. We want to partner with you. You can visit us online at www.orangecounty.com/aging. You can also like our Facebook page, which is www.facebook.com/Orange County OFA. Our single point of entry, again, 845. It says 888. It's not. It's 845-615-3710. And that's my slide presentation right now.
Thank you so much, Anne-Marie.
Yeah.
Really appreciate all the wonderful information. And just so everybody knows, we will be able to share all of those resources via email at the end of the presentation. So you will have access to those phone numbers again. Thank you.
Thank you.
So for those of you who just recently joined us, as I get ready for our next presenter, Robin White, just keep in mind, please keep yourselves on mute and also your cameras turned off as well. In addition to that, please keep in mind to include any questions you may have in the chat box. We will be checking the chat function at the end of the presentations so that we can have a time to answer all the questions. All right, so next up is Robin White.
Good morning.
Presentation. Morning, Robin.
Good morning. Good morning, all. Thank you so much for having me here on this, because Aging and what's happening to the community during COVID is so serious. And one of the things that Mary Ann alluded to, outside of the mental health, outside of the food insecurity, there is also housing insecurity. And COVID has done a very quiet, sneaky little thing with, you can put up my side, please,
Yes, sorry, I had some issues.
with the Black community. Um, Racism in the real estate industry has been something that, yeah, okay. No problem. The history of racism in real estate started during the FHA, which was started in 1934. But before then, in 1920, there was a lot of restrictive covenants. And because of that, the Black community has not been able to get the equity in their homes that would help with their aging population. For in fact, can you go, did you know? Yes. Did you know that right now in the age group between 65 and 74, 5 times more Black seniors are dying from their white counterparts. Okay. Also, and then it decreases a little bit as it goes up, but it's still more between 75 and 80, between the ages of 75 and 84, it's 3.5 times higher. Between the ages of 85 and up, it's 2 times. Hispanics also are, have high rates, but not as high as the Black community. And they're dying in places like their homes and in apartment homes and senior complexes. But when you start to talk about the seniors during COVID, one of the problems that they're having is that as they are isolating, as Anne-Marie alluded to, they don't have family members that are able to help them. They don't have family members that are there to be able to attend to the lawn care or to the services that need to be done. And because of this, there's a depression of their homes. They're not getting the same value. So if they need help or they need to transition to places like senior homes, they don't have the same dollar buying power. And the senior housing industry does not see Black Americans as being very viable. Okay, they don't see them as being viable to have the amenities of healthcare, senior housing, where they could be in there with their home, but yet have the healthcare. They don't see the viability of them being able to make something affordable. Senior housing is not affordable to the majority of the minority community. So here we have, they've are now losing their earnings. Some still work. They don't have social funding. There's lack of appropriate health care coverage. They don't have the traditional support systems now because the churches are closed, a lot of the large communities. So they get into trouble with their mortgages. And there are predators that come around and say, look, I'll give you cash for your home. It's pennies on the dollar. And then once they do take the cash, where are they to go? Sometimes that makes them too rich for some of the affordable housing, but not rich enough to afford the housing. So what we're starting to see is, it's very quiet, is that our seniors are becoming homeless. If you look around, and I'm sure that different communities can attest to this, at the food pantries, there are more seniors. On the street, there are more seniors. In the publicly funded healthcare, there are more seniors. Where did they go? In this great city of Middletown, in which I live, there are pockets of areas where people are in the woods, they're in tents, and a lot of them are seniors. It's getting colder. They're not able to take care of themselves during this inclement weather. Where do they go? One of the things that we need to partner with is with the developers and to see the need of what we have for our seniors, especially in the Black communities. It is time for our investors to understand that this is a community that has served their country, they've served their community, they've served in all walks of life, and they need to be served now. Partnering with the state, partnering with the local governments is one thing, but we also need to partner with the private sectors. We need to raise our voices and say there is a need for help for our seniors, help in the Hispanic community, help in the Black community, because they're dying. They're dying at such a rate, even to the point that when they do pass, there's not funds to be able for them to be buried properly. So this crisis that is coming, and it's very quiet, it's very silent. Nobody's looking at it, nobody's talking about it. We do know that Black lives matter, but we have to also realize that our Black seniors matter. As you look around throughout society and you see the older population who are revered, they're taken care of. Our seniors are not being taken care of. And the basic need for housing is a need for everyone. As a realtor, I work with various senior groups. I try to work with anyone. I'm a little bit passionate about this, and Marianne, you did such a wonderful job, but it really reaches to my heart. As I have helped many seniors, I do call the Department of Aging. But the one thing, with the rents going the way they are, it's becoming unaffordable. The average rent in Orange County right now for a one-bedroom apartment is about $1,500. A two-bedroom is $1,800. The majority of the seniors do not have that type of funds to be able to fund that. We do not have enough senior housing. We do not have enough. Majority of the senior housing has a 2 to 3 year waiting list to be able to get in, to be funded. The roles of Pathstone and Section 8 have closed. Also, there is a stigma of those who need that type of assistance. Landlords do not want to take that. They would rather rent to someone who is working. So with this happening, and our seniors are no longer flying to, down to the south where it's more affordable, we have a very growing population of seniors who will not have housing. If we do not take hold of this, we're going to lose them. We're going to lose them in all kinds of ways. And it's so valuable to have a grandparent or, two or three generations that can give back to our youth, that can give back to our community. They are viable. We need our seniors. So what does our future hold? Our future holds that we have to get together and look at this and talk to it and have this difficult conversation that there is a population that is dying out, that is in need, that we have to find a solution to. I know that as a realtor, it does sound different for me to advocate for people who maybe cannot afford to buy a home. But if we do not take care of our seniors, our future is at stake because grandma and grandpa will no longer be around to be able to help keep the history of our culture and what we have gone through. So once again, seniors in housing, if there's anything, if you want any information, if there's any seniors who need to know the value of their real estate, please, I can be reached. I'm at Keller Williams. My name is Robin White. I'm not doing this to promote me, but I don't like that seniors are being taken advantage of because they do not know the value of their home. So, Analdi, if you want to share my information, that's fine. But it's very important. We need to hold on to what we have, and what we don't have, we need to develop. Thank you so much.
Thank you so much, Robin. Really appreciate that. And yes, your information will also be shared at the end along with everyone's as resources. So thank you for sharing.
Okay, you're welcome.
All right, Doug. So next, Doug Hovey, CEO of Independent Living.
Great. Can everybody see me and hear me? We always have to do the sound check. Good morning. I was going to say good afternoon. I got up so early today, but it's really a pleasure to be here today. And Anne Marie and Robin, thank you for your remarks. You really highlighted a lot of the key reasons why older adults become unstable in their homes, whether it's housing insecurity, food insecurity, or medication insecurities. I mean, these are the sort of precipitating factors that cause people to need more assistance in their homes, or they end up in a nursing home unnecessarily. We know that is a huge problem in our society today. So let me back up a little bit. I'm Doug Hovey, and I'm the Chief Executive Officer for Independent Living Incorporated. We are a cross-disability consumer-directed organization that represents the interests of people with all types of disabilities and all ages from birth until end of life. And I can tell you over the last 9 months, I have spent an inordinate amount of time focused on nursing home issues and issues faced by older adults who are challenged with making that decision, and their families are challenged with making that decision about whether or not they can stay in their home or go into a nursing home. Our system is not where it needs to be today. We have to continue to work together between state and local government and the private sector to be able to improve our capacity to support people to stay in their homes. So I'm going to be talking quite a bit about nursing homes, and I'm going to be talking a little bit about the inequities in our state infrastructure that leads to disparities for the older adult population at the local level. So I have a couple of slides I want to put up. I'm going to see if I can get them up. Oh, I think Inaudi, you disable participant screen sharing. Can you just give me permission to share?
Yep, give me 1 second. Go ahead, Doug.
All right, I hope everybody can see that. And I'll do my best to characterize the slides for anyone who may not be able to see them. So the caption says, "Our homes, not nursing homes." And then, of course, it has my name there. The next slide is a picture of 4 adults, older adults, enjoying themselves in the community. And the caption says, "What's wrong with this picture?" Right? And the answer is absolutely nothing. It's as it should be. People should be able to get out and enjoy themselves in the community. And we know how difficult that is during the coronavirus. And these are very, very challenging times for adults getting out to enjoy themselves. So as Anne Marie eloquently pointed out before, older adults being socially isolated are having a very, very difficult time on a number of different levels. So, you know, we think it's everybody's right to be able to live in the community and to age in place. One of the things I want to talk about briefly, I mentioned, is the clear funding imbalance among New York State agencies and communities and how this impacts our community. Okay, so I picked 4 state agencies and I have a bar chart here. And let me read the caption to the left for you to give a little bit of context. But it says, "The number of seniors most affected by long-term care needs and compounding health, social and economic problems has continued to grow at a much faster rate than that of the general population. Nevertheless, New York State funding allocations clearly suggest other issues are considered higher priorities." Okay, there's 4 bars here. It's a bar chart. And if you look at the first bar, it's the New York State Office of Mental Health, which has an annual operating budget of $3.9 billion and has 14,270 full-time employees. And then the next bar is the New York State Office of Children and Family Services, which has an annual operating budget of $4 billion and has 14,000 full-time employees. Then there's the New York State Office of Persons with Developmental Disabilities with an annual operating budget of $5.1 billion and 18,600 employees. And then the last bar, which we can barely see at the bottom of the chart there, is the New York State Office for the Aging, right? The Office for the Aging, funded at $257 million and having about 900 employees. So you could see that funding allocated for senior services to the localities is significantly a fraction of what the other agencies are funded at. So I'm just pointing this out because there's tremendous funding disparities, which means we have less resources. So I'm always impressed at the amazing work that our County Office for the Aging does under Anne Marie's direction. And imagine how much more they could be doing to help people when they're faced with long-term care crises if they were properly funded. So this is something that we're talking about at the state level. These conversations come up at the Most Integrated Setting Coordinating Council. I was appointed by the governor to serve as a member of that council. And we have some very, very tough conversations. These are not easy things to talk about. Getting people out of nursing homes is not something that is an easy thing to do, and it's not easy to talk about. I always tell my colleagues on the council at the state level, if we leave these meetings feeling warm and fuzzy, we're probably not doing our job. So I want to shift for a second here and talk a little bit about the deinstitutionalization movement. I think that's important to highlight. The caption to the left says, warehousing has been a traditional solution for managing the care of the elderly and the disabled. But in recent years, the tide has begun to change, right? And I say recent years, I'm really talking about the last 50 years, because it was back in the 60s and 70s that marked the beginning of deinstitutionalization for people with disabilities, right? Hundreds of developmental and psychiatric centers were closed, and we're still working in cooperation with the state to continue to focus on closure of large unnecessary institutions, recognizing that, again, these are not the right places for people to live. They never were. We just didn't know what to do with people with certain types of conditions. So, you know, the decision was to create these large buildings and try to support people living that way. Unfortunately, during this same period of time, nursing homes have continued to grow. So we haven't treated nursing homes the same way in terms of the deinstitutionalization movement, something that we're talking about again at the state level, and we need to talk more about this. And these are really social policy issues. This is everybody's business, right? Because it impacts all of us. And in 1999, there was something called the Olmstead Supreme Court ruling, which mandates that people who can live in the community settings should be able to have the supports in order to do so, okay? We still haven't gotten to full implementation of that or realization of that particular ruling. We do have a state law here called the Most Integrated Setting Law, which was passed in 2002. So, you know, almost 19 years ago. And that also reinforces this Olmstead Supreme Court ruling that really mandates that we have to provide supports to people to age in place to live in the community rather than put them in institutions unnecessarily. So we're still working on that. In 2020, New York State continues to support over 630 nursing homes and providing crowd care to an estimated 130,000 people. Now, you know that the coronavirus has underscored the need to radically redesign the long-term care system and introduce more community supports and begin to coordinate a better system of long-term care supports in every county across the state so that people have demand responsive support when they're faced with a long-term care crisis. We really have to work on building better supports and think about the phased elimination of nursing homes as we know them today. And I know that's difficult for some people to digest or comprehend, but that's a reality. We do have to start moving away from these large facilities that are 50 bed, 100 bed, 200 bed, and some even as large as 500 and 600 bed facilities that you can't possibly provide the same level of quality of care, safety, and dignity for the people that live there. Today's typical nursing home just doesn't come close to meeting the public's desire for humane and dignified long-term care, and warehousing large numbers of our family members, our frail elderly, in hospital-like buildings with residents in double and triple occupancies, sharing bathrooms and sharing bedrooms, and having turnover rates as high as 100%. This, unavoidably creates high risk for resident safety and compromises quality of care. Even before the pandemic, by the way, 82% of nursing homes across the country had infection prevention and control deficiencies cited in between 2013 and 2017. And 50% of these nursing homes were cited multiple years for these infection control deficiencies. And then you introduce something like a pandemic, like the coronavirus. And many of you may know that we lost at least 7,000 people right here in New York State that are nursing home residents. And that number is a little bit skewed. We can't seem to quite get the actual data because that number was just specific to people who died in nursing homes. It did not include the number of people who were transferred to hospitals from nursing homes and died. So this is horrible. This is, it's estimated that 40% of the deaths here in New York State were people that were living in nursing homes. And there was an executive order back in March. The governor, I think, was trying to do the right thing by telling nursing homes that they could not deny anybody's entrance into a nursing home, even if they had COVID-19. I mean, the unfortunate reality is nursing homes were not prepared to control that infection, which is why we saw the spread of the coronavirus in nursing homes. I mentioned the Olmstead decision before, but the caption to the left of this next slide says, "The extent of opportunity governs the right to choose." There's something called institutional bias. I have a family member. It was my mother. She's 85. My dad's 87. My mother ended up in the hospital 2 months ago. She had a fever. We thought she might have coronavirus. She was there for a week. As it turned out, she didn't have coronavirus, but she was very weak. And the institutional bias, and as much as she got the best care, and I have to, really put a plug in for Montefiore St. Luke's Cornwall Hospital. They did a fabulous job. And we were very pleased with the quality of care. When it came time for discharge, the staff recommended that she go to a rehabilitation center. And now to my brother, that sounded like a good idea, thinking, well, mom will get some more physical therapy and that'll be a good thing. Well, I explained to him that the rehabilitation center meant she was going to a nursing home. And I didn't think it was a good idea because she had already experienced transfer trauma by not being in her home. And at the same time, my mother was saying to us, why can't I just go home? Why can't I just go home? So we had a meeting with the nursing staff, and we decided that we wanted to bring in home care and some assistance and some nursing into the house. And they immediately said, wow, that's great. Okay, you can do that if you want. And they made the referrals to some local home care agencies. So, but if I didn't have that familiarity, my mother would have ended up in a nursing home. And I think we would have lost her. I really believe that. And I say that based on experience. I've been around a long time and I worked with hundreds of families over the years, helping them to do their long-term care planning, to help mom and dad or their aging relatives to stay at home, to do whatever we need to do to make that difference. So again, it's the institutional bias that we're continually fighting. So achieving the goal of integration and aging in place really requires state and local government support. We need more funding for the offices for the aging, and we need a better system of care like the mental health system. The mental health system has a well-defined single point of access that meets every week to talk about people who are faced with housing and services crises. We need that same system here in Orange County and in every county across the state. And this is a conversation, again, that I'm having at the state level to try and make this a reality so that we have a better coordination, a better orchestration of services for people when they're faced with long-term care crises. We need demand responsive service coordination. We need orchestration of community services. As I said, there's a lot of wonderful services out there, but they're all working in isolation, in silos. They don't come together and communicate about the interests of the population of people in need. We need readily available information about options. People should be given all of the options, not just nursing home or not just rehabilitation center. What options do you have to keep your family member at home? That should be option number one. If you can't bring your family member home because the house is not accessible, we need to look at making it accessible. If it's not possible to make it accessible, option number three would be to find some type of an accessible apartment or housing so that the person can continue to live in the community and be a part of the community. The unfortunate reality about nursing homes is that once you go into a nursing home, you are no longer a part of the community. You are totally disconnected. I go to hundreds and hundreds of meetings, it seems like every month, with health providers and human service providers, and never once do I hear people talk about the population of people in nursing homes. Never once. Because they're separate. They're in isolated, segregated facilities that are not a part of the community. Congregate care separates and excludes. It promotes invisibility and negligence. So in this chart, we have 4 circles. At the top, we have exclusion and separation. I would assert that that's what happens with nursing facilities, nursing homes. And then on the bottom, we have integration and inclusion, community housing, community supports. We need more accessible housing and subsidies that can help families to continue to keep their loved ones in the community. We build an awful lot of new housing every year in New York State, probably not enough. We always talk about affordable housing. We have to start adding accessible. Every time the word affordable comes out of our mouth related to housing, it should be attached with accessible housing, affordable and accessible housing. According to the Census Bureau, the population is, I mean, we know this. I don't have to cite statistics from the Census Bureau, but the aging population is just exploding. So authentic inclusion is such an important part of the solution. Anne Marie spoke about the social isolation. Well, you really want to isolate somebody socially, put them in a nursing home and be surrounded by other people who are just having lots of challenges as a result of being socially isolated and not a part of their community. We've got to do better. We've got to figure out ways to help people stay in their homes. And so many families, when they're in crisis, they don't know where to turn. So things to know: aging in place, accessible housing, access to home. Access to home, by the way, is a program that exists in New York State. Unfortunately, it's not funded very well, but it allows some funding to help people modify their homes, small grants to help people build ramps, widen doorways, make their bathrooms accessible so that they can continue to age in place. The NHTD, Nursing Home Transition and Diversion Waiver Program, another program that here is in New York State. You have to be Medicaid eligible. If you can get into the program, it is bureaucratic, no question about that. But if you can get in, it can provide you with some pretty tremendous supports. The Consumer Directed Personal Assistance Service. This is a home care program that allows you as the disabled consumer and your family members to recruit, hire, and train your own workers to come in and provide care for you so that you can stay well in the community. And this has provided tremendous flexibility and opportunity for people. And then, of course, you have your licensed home care services, you've got certified home care services, and a whole array of other types of long-term care supports in our communities. But again, they're just not coordinated. So we need that state and local government assistance to coordinate these services. And I know Anne Marie and I talk about this all the time, and we're working on doing that here in Orange County, but we do need more support from the state. And then, of course, there's Medicare, Medicaid, and private pay. Important to understand how the insurance works, right? Medicare is typically short-term funding to provide those in-home supports after discharge. Medicaid, obviously, is you have to meet a financial eligibility. You have to be at or below the poverty level for Medicaid. And then for all others, it's private pay. It's just the reality. And so there's a lot of planning that is involved in understanding how to pay for these services, okay? And then there's some other more complex issues like spousal refusal that if you ever want to talk to me about that, I'd be happy to meet with anybody on this webinar here to talk about spousal refusal and how that works, okay? But in conclusion, New York State must take immediate steps to redesign our long-term care system, from congregate facilities to community-based supports and services, and housing that allows people the same opportunity as all others to live in the community, to age in place. We have to do better. It's not right when we send people to nursing homes and they have to share a bedroom and a bathroom and lose their dignity. So we've got a lot of work to do, and I hope this was helpful in at least kicking off the conversation here at the local level. Thank you very much.
Thank you so much, Doug, for all that wonderful, relevant information. We really definitely appreciate it. So I am going to go ahead and ask one or two questions of the panel. And this can also serve as some time for the participants who would like to go ahead and ask questions. Please enter them in the chat box. I will get to many of your questions, if not all of your questions, as we continue. So if all the panelists can join us back and turn your screens on so we can have a conversation. And that's just for the panelists. Participants, you can continue to keep your screen off. So the first question that I have is, and Anne-Marie and Robin, you kind of alluded to it during your presentations, is I want to talk a little bit about ageism. And Anne-Marie, you said how that is one of the isms that we don't really talk a lot about. And it really is. It really is. It actually is definitely one of the highest complaints that I get in conversations in our office here at the Human Rights Commission. But can any one of you or a couple of you jump in and talk about what does ageism look like, whether it's in our everyday lives, right? So not only for the folks going through it, but how do we participate in ageism and what could we do different? So if we can talk about some examples of what that looks like.
Yeah, I can talk about that a little bit. In the Human Rights Commission and in Audi and I and other community partners did an ageism symposium last year, and it was very well received. And, you know, I think it's so ingrained in our society that people don't even realize they're doing it. You know, I used to say, if I couldn't find my keys, I'd be like, oh, I'm having a senior moment. Well, that's ageism. That's, you know, no, it's because I've got 12 things on my mind and I don't remember where I put it, you know? You know, when you mock people with gray hair, when you ask if somebody's going to be retiring or you're going to get a rocking chair, you know, that just creates the atmosphere that you're kind of done. You know, you don't have value. And when you don't have value, you don't respect people. You know, I think Doug was, you know, spot on that when we put people in nursing homes, that we just, you know, we put them on a shelf and we forget about them, and they're not members of our society. And we know how important social determinants of health are. So we are now fighting back. When I would go up to Albany to to lobby and advocate for funding. And Doug, I have to tell you, I've always known about the disparity of funding, but putting it on the chart just slaps you in the face. But we were always told we're kind of a one and done thing. We'd go up there, we'd advocate in February, and then they'd put us back on the shelf. Well, it's a new time. We're not doing that anymore. And our population is growing. It's becoming the fastest growing population. So there's power in numbers, and with that, we're going to take advantage of that because you need respect. Everybody needs respect. Everybody should not be, kind of put by the sides. So we are starting to be loud and hear us roar. And you're going to see new things to come. But think about it. Just think about how you would want to be treated. That's what I tell everybody. That's how I told when I brought my kids up. How would you want to be treated? Would you want to be talked to that way? And I think we have to think about that with older adults. Yes, you may have to talk a little slower. Yes, you may have to talk a little louder. But that doesn't mean that there's not true value there. So yeah, we've got a lot of work to do.
Anne Marie, when you talk about respect, somebody just commented on the chat, and this is something you and I have talked about in the past. And this person's example is she was with her mom who turned 88 yesterday, and the doctors would only talk to her instead of her mother.
Huge.
And it's, we've talked about this in restaurant settings or, doctor's offices where the individual ignores the older person.
Yeah.
I would like to dovetail on that too, because quiet as it's kept, the baby boomers own most of America as far as housing is concerned. And we are aging and we are doing it differently. We are capable of getting mortgages. We are capable of building communities. So what happens is that in the real estate community, sometimes we do overlook that person who comes in with gray hair, not understanding that they are powerful. They do not want to live the same way that their parents did. Their needs of their housing is different, but just as viable. So yes, ageism in real estate is huge because there's an assumption is one and done, just as you said, that we have reached an age where we are no longer viable. Not true. We hold the power as far as that. And as far as the housing community is concerned, we own the inventory, okay? It is in the hands of the baby boomers. And even though the millennials are not doing what we did, they don't understand the investment that we have made in this country. So we run a lot with it. You're absolutely right, Anne Marie. And that assumption that we're over the hill is long gone, gone.
Absolutely. And actually, it does remind me when we talk about ageism, bringing it to the workplace, where we are finding age discrimination starting at, much younger age, right? We're our 50s. It's comments that are made. It's, people being asked, well, can you do that? Can you handle that? Mm-hmm. Or the assumption that, an older person, and quote unquote older, right? Because how do we define older in the workplace can't figure out technology, or they can't, keep up with the new technology demands. So really being mindful of our language, being mindful of our biases and the stereotypes that we may fall into is really, really important. The next question that I have is actually around home care workers. Someone here in the chat box mentions it. And I want to talk about, how understanding how demanding the job of a home care worker is, and understanding also the shortage of home care workers. And Doug, you talked about, the lack of funding, and where the funding is going and where it's not. How can we improve the situation of home care workers, whether it's the high turnover rates, the need for more support, the need for higher pay? How can we support the situation to improve it?
Yeah, good question. And let me sort of dovetail on what Robin was just talking about, and I'll tie into your question, Anouti, but there's tremendous ageism and there's tremendous gender and racial discrimination inherent in our long-term care industry. And let me explain what that means. Is that when you talk about worker shortages is the nursing home workers and the home care workers, there's a tremendous shortage of workers there. And there's tremendous disparity in pay scales, in compensation and benefits. And keep in mind that the majority of workers in these industries are women, number one, and oftentimes women of color who are, again, working very, very difficult jobs. We don't have enough workers. Why don't we have enough workers? Well, because I can make more money flipping burgers at McDonald's than I can getting up every day and taking care of elderly and disabled people in their homes, right? So there's a systemic discrimination inherent in the way that we treat this industry. And I would say that it's ageism and it's gender and racial discrimination, right? So we have to work very hard at changing that, changing the dynamic, making this a professional industry, supporting people to make careers out of helping people to stay in their homes. But there's a long history to this and the evolution of why there's still this ageism and gender and racial discrimination. It goes back hundreds of years ago because it was expected that women were expected to stay home and take care of children and aging parents. That's what they did. They didn't get paid to do that, right? And they made dinner and they took care of the house and they took care of everything, right? But that's not the way the industry is today. The industry is designed to provide professional, demand responsive support in very, very challenging situations to keep people well in their home. So the home care industry, we need to rethink this. And this is all part of the need to redesign our long-term care system, not just redesign nursing homes, but we've got to think about the community support industry, make it more on par with other healthcare industries. So I hope that helps to answer.
Definitely, thank you. Anne Marie, this question is for you from our chat box. We need some clarification. Is the OFA number, so the Office for the Aging number, the same as the New York Connects number?
That's our single point of entry. So our New York Connects is in our office, and the number is 845-615-3710.
Okay.
It comes right into our office. So yes, it's one in.
And can you tell us, for the people in the audience that refer the phone number and refer to your office, what can they tell the seniors to expect when they call? A little bit about the process.
So, we're really proud of our New York Connects. It's our single point of entry, like I said, but we have we kind of call it the pit. It's this very large room. We have about 10 people there. They each have their own cubicles. So when you call in, you get a live person. You don't get an automated, press 1 if you need this, press 2 if you need that. You get a live person. Occasionally we will be busy and you'll leave your name, but we will call you back and we will just walk you through what your issue is. So it can be any variety of issues that you have. If we have the solution, we'll help you with it. We'll walk you through it. If we don't, we'll tell you that we don't. We'll research it and we'll call you back. So it's a very individual form of communication that we have, and we think it's very important to do it that way. Nobody likes to, there's nothing more frustrating than me calling somebody and saying my wait time is going to be 23 minutes. I want to talk to them right away. And then when I get them, you can't help me and it's an automated thing, you're going to get a live person.
Awesome. Thank you so much. Doug, I wondered if you can touch a little bit about this, because as I heard you answer the last question, I heard also how intersectionality plays a really big role in the things that we're talking about today. Someone in the chat talks about their experience working with aging people with deaf and who are hard of hearing. And they say that most nursing homes and rehabilitation centers, in their experience, are unaware that deaf and hard of hearing people are needing to gain access for ASL interpreter services, TTY, and video phone internet. in their experience, nursing homes and rehab centers need more training, workshops for people with disabilities and deaf and hard of hearing. And obviously, it's because of the ADA. Can you tell us a little bit more about maybe some of those challenges, or what are we seeing when it comes to people who are aging and deaf and hard of hearing, or hard of hearing?
Yeah, sure. A lot of our professionals do work very hard. They're amazing at providing the assistance that people need, whether it's in the home care community or whether it's in congregate care facilities. But I will say that there's not enough training to understand the needs of people who are deaf, people who are blind, or people who are both deaf blind. And so it's really important because what happens is we see people, professionals, again, well-intended professionals, they don't understand, they can't communicate with folks. So they tend to think that they don't have the capacity to live independently or to be able to do things for themselves. And so that really negatively impacts the relationship between the care provider and the consumer in need of those services. So interpreter services are critically important. We still have a lot of organizations that refuse to hire interpreters, although it's the law that, if someone comes to get services from your organization, and we have organizations that just say we don't serve people who are deaf, which is unfortunate because people need to be able to avail themselves to the broad array of community resources. And people who are blind, you have the New York State Commission for the Blind, which is a fabulous organization, a great resource if you're working with people who have low vision or may be blind. That's a great resource. And, I just think there's a lot of training. There are resources for deaf supports and services. There's wonderful interpreter services in our community. Two companies that we use on a regular basis, and it's the cost of doing business from my perspective, right? So we have a separate line item in our budget that makes sure that we have the available financing every year to make sure that we can provide interpreter services for people who are deaf.
Perfect, thank you. We've got time for a couple of more questions. I wanted to talk a little bit about affordable housing. Robin, you started mentioning that in your presentation, and Doug, you also talked about it. As we know, there is a continuing need for affordable and accessible housing, as Doug helped us remember to put that in there. Could we talk about what recommendations any of you may have so we can start, and maybe not start because the conversations have started, but how do we move from conversation to solutions? What should we be looking at, and how can we work together towards achieving more affordable and accessible housing?
Okay.
I could jump in just quickly. Or go ahead, Robin, I'm sorry.
No, Doug, go ahead.
I was just going to say, I mentioned earlier that every year there's new funding appropriations that come from the state, and I have to give credit to the governor and the state for doing such a good job of creating more and more affordable housing. I think we need more, clearly, and there are certain pockets around the state that don't have the same amount of housing that we have here. We're very fortunate here in Orange County. We have a fabulous developer who's built many apartment complexes that are affordable and they're accessible too. I think where we fall short here in New York State is we talk about affordable housing. Again, it's not enough, but we don't emphasize the need for accessible housing to the same degree. I would say what we need to do is make sure that every single affordable housing unit that is built, particularly new construction or major renovation, be mandated to be accessible. I can tell you another developer that I've been talking with recently is renovating lots of buildings, and not one of them is going to be accessible. And I don't get it. I'm having conversations with the state about this. This is not right. You cannot have major renovations of existing structures and not make them accessible. It just doesn't make sense. Particularly if you have ground floor buildings, right? you may have a structure that's multiple floors. At minimum, the state law should require that the ground level units all be 0-step entrances, wider doorways, so that people can age in place.
Thank you. Rob?
I do agree with Doug as far as that, but another area of shortage, affordable housing doesn't necessarily mean senior housing or 55 plus. In that area in Orange County, we have a shortage, and they're not necessarily affordable. Not every senior wants to live in a home that has children. Okay, some of these large complexes are large, but they're, as seniors, they want a little bit more quiet and they need different amenities. I think one of the things that we need to do is to bring that out to our developers to say, yes, you would like to build affordable, so maybe make one of the buildings senior housing, which has different requirements, where you will have the accessibility because you have to build that in senior housing. Okay, but then there is the 55 plus, which those are people who are still working, but are considered seniors and don't necessarily, once again, fit into the affordable housing, but cannot fit into the existing housing. So 55 plus housing needs to be amped up here in Orange County, as well as senior housing. Like I said before, most of these facilities has a 2 to 3 year waiting list.
Thank you for that. And actually, to add to the complexity of the conversation of affordable and accessible housing, I don't think a lot of folks know that for in many complexes, these affordable housing, we're talking about $1,200 and up, which to many families, that's still not affordable. So when we are discussing affordable, we really should also be looking at what is affordable for everyone, and how do we actually make some of these developments affordable for everyone. Another question that we have here is around streamlining services. And, it's really, we have in Orange County, we have an excellent amount of resources. And speaking of aging specifically, I know that there are, Doug mentioned the 100 meetings that we go to, and the different agencies or the different programs. But could we talk about, someone wants to know, how do we streamline these services? How do we come together? How do we become united? Or are we already doing that? How do we streamline it so that it is easier for our older population and or for service providers to be able to help and assist folks get the help that they need?
I can talk about that. Again, we Office for the Aging has always kind of been the best little secret around. So advocating, marketing is a big part of my job, to let people know that we're there. And I don't just talk to the older adults. I talk to their kids. I talk to people in their 40s saying, you may not need me right now, but down the road, keep it in the back of your head that you may need me. We have a long-term care council, and Doug is very active in it and plays a really important role. Office for the Aging and Independent Living Center have a very unique partnership. We actually have one of Doug's staff that actually has an office in our office, and so that we can help everybody, whether you're below 60 or over 60. Office for the Aging considers older adult 60 and older. But we have a lot of community members that are on that council, and we talk about things. So again, I think it's education, it's awareness, just letting people know that the services are out there. I can't tell you how many times I run into somebody or somebody will call me, and the calls that we get, unfortunately, are mostly crisis calls, or what people could perceive as a crisis, because, mom fell and she's in the hospital. And just like Doug said, they want to now put her into a nursing home. Well, during COVID, nobody wants to go into a nursing home. So what do? Can they get an aid? What can they do? But if we can educate people that these first are services that are available, but also that you qualify for it. A big issue that we have is we are a government agency. People look at us as charity. So I always say I deal with two different populations. I deal with the greatest generation, which are, kind of World War II, Korean vets. they don't want charity. You know what? They're a tough breed. They're going to live through this. They don't need it. I remember my dad had a very, very serious surgery. It was a 9-hour surgery down in the city, and they were going to give him morphine for the pain. And he said, you know what? Give it to somebody that needs it more than me. And I'm like, Dad, I think there's enough morphine for everybody. You can do it. But that was their mentality. We've got a younger, older generation, if you will, that, says, no, we deserve these services and we should have these services. So I think it's letting people know that this is not charity. People have worked their whole lives. They've paid into this. These are just services that are due them. The 1965 Older Americans Act created the home delivered meal program and the congregate program and services to assist our older adults. And as a society, that's what we should be doing. We should be taking care of our older adults. So again, education, awareness, just getting the word out. And our long-term care council does a lot of this. And, truly in Audi, panels like this help. So thank you.
All right, wonderful. So I want to just take this opportunity to wrap up. I want to give the panelists a second. Is there anything you weren't able to share or any final thoughts that you'd like to leave our presentation with?
For me, Anali I know that the real estate community is looked at more as a profitable business and not as community orientated, but we are. There are a group of realtors that are very interested in what's happening in our community because it's in our communities we have our business. So if we're not serving our complete community, then we're not being a service in our industry. So I would like to see more developers, more investors to come on, on the table and talk about senior housing and affordable housing and accessible housing so that our community can stay viable.
Thank you. Doug, any final thoughts?
I'd also like to say, I'd like to see more support for older adults to live in the community. In addition to affordable and accessible units, we come up with housing subsidy programs too that assist families who don't have the wherewithal or individuals that don't have the wherewithal. But, I always encourage integrated housing. So as we build a complex, let's say 100 apartments, having maybe in that building set asides, maybe, 15 or 20 for dedicated to seniors that may have lower rents, reduced rents, or rent controls, or even subsidies, so that they can continue to pick and choose if they want to live in the community as a part of the community. And the last thing I'll say, Audi, is that I think this has been wonderful, the opportunity to speak together like this. And I think we have to continue to meet and orchestrate the existing network of long-term care providers. We need to come together and talk to one another because that builds the synergy and the capacity for us to become more effective. I mentioned before, we do that very effectively in the behavioral health system, the single point of access under Darcy Miller's leadership, our commissioner here. We have a great orchestration of regularly scheduled meetings, in fact, weekly, where we literally talk about those people in crisis. And by working together, we're able to strategically figure out how to help them so they don't fall between the cracks. We need that same system. And that's something Anne Marie and I have been working on, and we're working towards that goal, but we also need more support from our state.
Yeah, and I'll piggyback on Doug. We are creating synergy. It takes time, but we are moving the dial forward. New York State is the first age-friendly state in the nation. So we have been hammering it home, like, thank you for designating New York State as the first age-friendly state in the nation. But put your money where your mouth is now. And last year, Orange County started the designation of Orange County being an age-friendly county. There's about 6 age-friendly counties throughout the state. So we're going to be, and again, COVID has kind of skewed everything up, but what we're going to do is hopefully when our new world opens up, we're going to be doing pilots of a city, a town, and a village, making it age friendly. And Doug and I have talked about the city of Newburgh is going to be one of the locations. So we're moving forward, but we're not going to go backwards. And we can learn so much from the DD population, the way they do it. I love their housing approach. If, you know, in 20 years, if somebody said, do you want to live in a facility, which, and I'm not knocking them, there are some wonderful, wonderful quality nursing homes. Do you want to live in a nursing home, or do you want to live in a house with like 4 of your peers and you know, you go out and it's a Golden Girls situation? Well, guess what? I'm going to pick that. So we need to make those options viable for everybody. And I think while working together, we can.
Awesome. Thank you so much. I just wanted to really thank the panelists for your time, for your expertise, for your passion. And Marie, to, you know, close off, you know, it does take time. It does take time, but you're right. We do have to put our money where our mouth is, right? And we have to do the work. And I think this is a great testament to the work that is being done. So thank you all. Thank you to our ASL interpreters so much for interpreting for today's program, and for all the participants who are present. We really are happy that you were able to join us. And for all of those of you who will be just watching, maybe you couldn't join us today in person, but you'll probably be watching on YouTube. Please feel free to, you know, sign up for the Human Rights Commission's emails. We host programs often on really important issues and conversations about, again, you know, things that are really impacting the most vulnerable communities here in Orange County. And also you'll find this recording along with many other recordings of forums that we have held this year, specifically around COVID or challenges faced by different communities, disparities, etc., on the human rights webpage through the orangecounty.gov.com webpage. So once again, thank you so much for everybody who could join us. Thank you, panelists. It was really quite a pleasure.
And Ali, this is Deborah. This is Deborah. I put one question in the chat about transportation for the seniors. Will y'all be touching on that?
We are at the end of the presentation, Deborah. Was there a specific?
I put it in the chat about what about transportation improvement for the seniors. If you're having another webinar, I'll be on it. But I'm just saying, you touch everything else pertaining to seniors, but transportation here in Newburgh is a big issue with seniors.
Yes.
You know what, Deborah, give us a call at New York Connects. You're absolutely right. Transportation,
Okay.
we could probably do a panel just on transportation,
Thank you.
because that
Thank
is
you.
a huge issue.
Okay, where you said New York what?
The New York Connects, which is 8.
I got it. Thank you.
Perfect. Thank you so much, everyone. Have a great day.
Thank you.
Thank you.